So, this topic that we're going to be talking about today is really close to the hearts of many parents and caregivers, and that's about managing sleep issues in children with autism. Hi, everyone. I'm Dr. Funke Afolabi Brown. I'm the founder of Restful Sleep MD and the Restful Sleep Place. And our mission really is to help kids and their parents change their relationship with sleep so that they can thrive and they can reach their fullest potential. Now, in our prior episode, we talked about sleep in children with autism. And when we talked about that, we really delved into a story about Libby. Libby is a 7-year-old girl with insomnia and autism. And we talked about some of the things she did. She took some iced tea with dinner. She played on her iPad, which she got from her birthday, and she plays Among Us till nighttime. And she did have difficulties falling asleep and would repeatedly call for her parents every time they left the room. She needed them to come to stay in bed with her, and she would go out of the room multiple times, and bedtime was a battle. And even when she eventually fell asleep, she would wake up multiple times throughout the night. She would call out for her parents again to have them come back for her to resume sleep. She was felt to be really active during the day, and she was always on the go. The other thing was that they observed that she snored really loudly, and there was a family history of sleep apnea. Her dad had sleep apnea. And so we talked a lot in the previous episodes about the different reasons why children on the spectrum may have sleep issues. So if you missed that, definitely check it out, and I'll attach that to this video. Now, in this episode, we're going to be talking about practical treatment strategies that can make bedtime smoother and more peaceful when it comes to caring for children on the spectrum. Now, one thing I want you to remember is that sleep issues are as high as 80% in children with autism. So this is something that's very common. So if your child is struggling with sleep, you're not alone. And their sleep struggles can range from challenges with falling asleep, staying asleep. They can also have a very irregular sleep patterns. And the triggers for the sleep issues are so many. It could be sensory sensitivities. It could be related to their communication difficulties, or, we're even finding out maybe some melatonin production abnormalities. And then the other pieces, there may be behavioral things that are going on, right? They may be watching TV till late or on their iPad till late. And so that's suppressing melatonin. They may be drinking caffeine before bed, like Libby, our patient, right? They may also be taking naps because they're so tired. So you have this complete vicious cycle where they're taking naps during the day and then they're not sleeping well at night. So this can be a whole lot of problem for most parents. Now, let's talk about how we can get our kids on the spectrum to sleep well. Number one, you want to establish a bedtime routine. Now, if you've been on this show with me, you know that I talk a lot about bedtime routines. But when it comes to children with autism, this is so important. And a consistent routine, especially when you have a child with a lot of sensory needs and a lot of communication difficulties, is so important. Because what it will do is that it will cue their body in terms of helping them set that internal clock. And when it comes to getting a good routine in place, there are a few things I suggest. Number one is that you want to make sure that you are as consistent as possible. This is so important on the weekdays and on the weekends because you want them to know exactly what to anticipate, right? The second piece is you can use visual schedules. Now, a visual schedule or a visual chart really outlines the bedtime routine step by step and helps them to follow along. And they can be really very helpful, especially with children on the spectrum, because then it provides them very clear and predictable sequence of activities. They know that, okay, they brush their teeth, they get into their PJs, they pick out their book, right? So you can create one with your child or you can download online. There's so many that are available. And then the third piece about the routine is that you want to make sure that you incorporate calming activities. So find things that they enjoy, right? It may include a warm bath, listening to soothing music. If they enjoy massages, especially some of our kids that have a lot of sensory issues, that may be something that you can incorporate as well. The goal is find things that are calming and relaxing for them. And it's not about finding something that's scripted, it's finding what works for you. Now, number two, let's set a consistent sleep time and wake time. Apart from the consistency with the routine, it's really important to make sure that sleep time and their wake up time is consistent. Now, this time will vary based on the needs of your child, right? Every child has different sleep needs. So your child may need 9 hours, your child may need 10 hours. It's all about knowing what to expect. And so what you need to start off with is figure out when they need to wake up in the morning, like when did they have to get up for school? And then you just want to count backwards, right? So if you have a child who maybe needs to wake up by 6 a.m. for school, then you count backward, they should be in bed by about 9 p.m. But then you also want to make sure that you create a buffer time. So if they're supposed to be in bed at 9 p.m., that's not when you're starting their routine, right? It means you would have started their routine about 30 minutes before that, about 9:30. So just do that math and then figure out what works. But then you have to balance this also. You have to make sure you're paying attention to their cues, you're paying attention to their sleep needs, because you don't want them going to bed when they're completely not sleepy. And with our kids on the spectrum, I use a method called sleep fading in some situations, especially if you have a child who is not able to fall asleep for hours and hours and hours, and they're in bed tossing and turning. So what I recommend, and we'll work on this together, is you give them a temporarily later bedtime. So a time that's a little bit more aligned with their circadian rhythm, or more aligned with when they're most likely going to go to bed. And so once they start to fall asleep consistently, say within 30 minutes of that bedtime, then we start to gradually make your bedtime earlier. And so again, we work on this along with so many other things. So I don't want you to take that in isolation, but that's definitely a tip that I've seen that works a lot. Number three is that you want to create a comfortable sleep environment. So children with autism, children on the spectrum may have sensory issues, right? So you want to try to minimize stimulation as much as possible. You want to make sure that their bedroom is calm. Their bedroom is almost like a sanctuary. So think dimmed lights, think blackout curtains, think a white noise machine to mask out external noise. You also want to make sure that their bedroom temperature is cool. In some situations, you can consider using a weighted blanket or some other sensory tools, because some children enjoy that pressure. And weighted blankets have become really popular because what they do is they potentially can help improve sleep in children that have autism or in children with other sensory needs. And that's really something that parents have said again and again. Now, that weighted blanket, what it does is it provides this really gentle and even pressure across the body. And it's been felt to mimic the sensation of a hug or a swaddle. And so sometimes these children enjoy that. And it's been shown to have a calming effect on the nervous system, which may potentially reduce that fight flight response that a lot of our children have, and it helps to promote that relaxation. Again, I'm going to say the research out there is a bit mixed, so every child is different. So before you invest in something very expensive when it comes to a weighted blanket, I recommend you speak to their doctor or to their therapist. If they're getting occupational therapy or physical therapy, speak with them. Now, number four, you really want to limit caffeine, because what that does is that it serves as a stimulant that keeps them awake, right? Because it stays in their body for so long, because it has a long half-life. And then screen time, definitely something you want to curb, because what that will do is suppress melatonin production. And so about 30 to 60 minutes before bed. Talking of melatonin, number five is melatonin. For some reason that we don't fully understand, melatonin has been shown to help children with autism fall asleep faster, and it's been shown to increase their total sleep time. It's also been shown to decrease the anxiety they may have around bedtime in some situations, and helps promote relaxation, which then helps them to sleep. A lot of the preparations you have over the counter are short acting, meaning that they help with the sleep onset, but they don't necessarily help with the wake ups your child might have. In those situations, you may consider using what we call the extended release melatonin. Now, the goal with melatonin is you're giving the lowest dose possible for the maximum effect, right? So you want to really reduce going high and high on the dose, because at the end of the day, it may end up having side effects. And you absolutely have to give it under the guidance of a professional, under the guidance of your doctor. Number six is medical sleep issues need to be addressed. Okay. So if you have a child that has sleep apnea, so your child is snoring habitually, maybe up to 3 times or more a week, that is a child that you need to speak with your pediatrician about so that they can get a sleep study, because that is something that is medical. It needs to be addressed. It has a lot of long-term effects that are not good. Another medical condition is restless leg syndrome. And this is where our children have this discomfort either in their legs or in their arms, which gets in their way of sleep and can end up delaying their sleep onset. Or you'll see them just tossing and turning in bed all night long. They're the restless sleepers. What we've seen is that in children that have restless leg syndrome and children who has restless sleepers, they might have low iron stores. And if you think about your child on the spectrum, sometimes they may be picky eaters. So they're not necessarily eating your green leafy vegetables. And so their iron stores may be low, and that may be what's putting them at risk for their restlessness. And so really supplementing those iron stores can be very helpful and can even transform sleep in some kids. You also want to pay attention to some other medical issues like reflux, asthma, congestion, eczema. All those things can affect your child's sleep. So treating them may improve their sleep as well. Now, number 7 is really treating their insomnia. We use behavioral strategies. And so, in addition to the 6 tips I provided, we may need to incorporate certain behavioral strategies. And this may be when you need to see a behavioral sleep specialist to help with addressing these issues. So now we've talked a lot about how to improve your kids' sleep if they're on the spectrum. Let's go back to Libby. Now, what did we do with Libby? We worked really closely with her family. We created a consistent bedtime routine, and she ended up, doing activities she enjoyed, including reading, cuddling in bed with mom. And then, in addition to that, we provided a visual schedule. So she knew exactly what she needed to do when. She knew when it was time to put her iPad away, which was something we needed to work on. She knew when she was supposed to get ready for bed, when she was supposed to have a bath, brush her teeth. And so that really put everything out there for everyone to see and also gave Libby some control, which really was what she wanted. And then in terms of our insomnia, we worked on some behavioral strategies. We worked on a strategy called graduated extinction. And really what that is slowly but surely getting the parents out of the room. And the goal was to help Libby fall asleep independently, because when she was able to fall asleep on her own, then she was able to stay asleep. And then finally, because she was snoring, she had a sleep study. And that sleep study actually showed she had what we call sleep apnea, which is the pauses in breathing during sleep. And so from there, she was referred to the ear, nose, and throat specialist, where they took out her tonsils and adenoids. Now, how is Libby doing? Libby is living her best life. She's doing really well. She's falling asleep at about 9 p.m. She's waking up at 7 a.m. She no longer wakes up in the middle of the night. School is better. Her behavior is better. She's kind of slowed down, but in a good way, right? So it was very helpful to go through all this with you and to really show how we helped Libby get her sleep back on track, because it is a possibility for you. We could get your child on the spectrum sleeping peacefully. And one thing I would say is, even though I specifically share this for children who have autism, this is really something that you can apply to any child, including your typically developing child. So if this video has been helpful, I want you to share with parents in your community. Help me get the word out there. And if you have a child that has sleep struggles, then the Restful Sleep Place is where you need to go. The Restful Sleep Place is a telemedicine practice. It's out of insurance, but that means you have direct care to me and to our team, where we provide sleep services for your child and also for your young adult with sleep issues. So if you live in Pennsylvania, if you live in New Jersey, hop on there, make an appointment, restfulsleepmd.com. And finally, do me this favor. This has been so helpful. This is a labor of love when I produce this content for you, to teach, to empower, and to educate. So subscribe to this channel, like and share, so that you help me get the word out there, right? I am like let's call it the sleep evangelist, and I can only do this if you're there to help me. So get this word out there. Comment, subscribe, share so that when new content comes up, you would be the first to know. Now, realize that when our kids sleep better, it's not just about the fact that we ourselves get better sleep and they are better versions of themselves. It's that we are creating a better future for them. So thank you so much for prioritizing sleep for your child. Thank you so much for prioritizing sleep yourself as a parent. And until next time, I hope you rest well.